of the EJV. This here is done in the vein here. We do this in scenarios like cardiac arrest, or if we can't find a vein anywhere else, it's used as a last resort. We always gain consent first and inform the patient of the treatment we're about to do. Okay, so first we need to extend the regular vein. We do this by turning the patient's head to the side, which gives us a better view. We can tamponade the vein, and this will descend the vein, or we could push down on the liver. We could also ask the patient to bear down if they were conscious. Okay, so our patient's not conscious in this scenario, so first we're going to find our vein, tamponade. I can see it nicely here. I've got my alcohol wipe. I'm going to clean the area in a circular motion in the upper half of the vein. This will hopefully prevent a pneumothorax. Okay, so while I let that dry, my gear is all placed out here in a nice clean area. I've got my needle here with 3 mils of saline on it. This prevents an air emboli. I've already had this drug checked from my offsider. I've also got saline here as well that I've already had drug checked. We've got all our gear placed out. Okay, sharps are out. Now the technique to this is holding it properly. You've got to hold your finger down low so you can aspirate. Okay, so we tamponade the vein. Just get that out of my way. Tamponade the vein. Use a little bit of traction. We go in. Just make sure that's done. Tamponade, traction. We go in on a 15 to 20 degree angle into the vein. And then we see if we are in the vein by aspirating. You can see a little bit of blood in there, so it means we are in the right area. Now we're going to lower down. We're going to go a further 2 to 3 mils into the vein, and then we're going to advance our catheter. Just do this by keeping the needle nice and still and just advancing the catheter like so. Alright. Needles out, straight into the sharps. Keeping that tamponaded so we don't have blood everywhere, and we're going to put our fluid plug straight on, just like that. Okay, first I just want to secure it just a little bit before I flush it. Now I'm going to prime my flush and give a couple of mils to our patient. When we're doing this, we want to check there is no swelling around the area to make sure there's no infiltration, to make sure we're in the right area. Make sure we're actually in the vein. Aspirate back. Great. And this should just flow nicely into the vein. Give about 5 mils. For the mannequin, I'm not going to give much. Alright, I'm going to keep that nice and sterile. And I'm now going to put my tachyderm on. And date and time this also. Sit around here, just like that, and pop the date and time here. And that is our EJV. So today we're going to give our patient some lignocaine for an IV line that we're going to put in shortly. This just helps with the pain of the IV itself. First things first, we've got the appropriate PPE on, and we have our gear all set up nice and tidy here. We have informed the patient what the procedure entails and also gained consent. So with our lignocaine, what we do is we check for allergies. We check if the patient's allergic to anaesthetic or has any other allergies. And then we get our cleaning wipe, and we go to as close to the vein that we're going to cannulate as possible. Normally I wouldn't be doing it here, I'd do it somewhere like the ACF, but for mannequin purposes, we're going to do it here. I'll clean the area in a circular motion, making sure I'm not redoing the same spot. And then I'll get my lignocaine. Me and my offsider have drug checked our lignocaine twice. So I'll open up the lignocaine, get that ready. Now I'm going to use a 5 ml syringe here. We normally draw up with a drawing needle about 0.5 to 1.5 mils for adults, sharps are out, or 0.2 to 1 mil for children. Today I'm going to draw up 1.5 mils. Go. I suppose the rest of my lidocaine. Cap. Just got to make sure that's accurate. Bubbles out. Awesome. Oh, like that. Okay. Take my drawing up needle off and put that straight in the bin. I'm going to use a 25 gauge needle, but today we only have 22 gauge needles, so that'll do. Cool. Now, sharps are out. I'm going to pull the skin tight and do a Z track. I'm going to tell the patient there's going to be a sharp prick shortly and go in on a 15-degree angle just under the skin. So sharp prick just under the skin slightly so we can just see it. So now I'm going to aspirate. Make sure we don't have any blood to ensure we're not in a blood vessel or a vein. Now I'm going to slowly inject the medication and watch for a bleb. The bleb's showing me that we are in the right area and we are just under the skin where we need to be. There we go. Now I'll dispose of the needle straight away. Now after doing this, I'm going to watch for any allergic reactions. I'm also going to wait to cannulate. So I'll wait about a minute before I do put my IV in. And then I would document the time, which is 3:30, the date, the route, the drug, and the amount. So lidocaine, and I've done 1.5 mils. Okay, awesome. I also have a plaster here, so if there's any bleeding or bruising, anything, I can just pop the plaster on.